the first thing I'll do is check to see that the order is in the computer from the provider. I'm reading the policy and procedures, making sure that I'm doing things according to that. I'm going to put on any PPE that's needed before going into my patient's room. I have my supplies here, my specimen container, my gloves, my wipes, and then I have my patient label. The things included on a patient label should be their name, identification number, route of collection, date and time, and my signature. So I'm now going to go ahead and go into my patient's room. Can you please state your full name and date of birth?
Tatiana Alberg, 8/14/96.
Okay, and I'm just checking her wristband in with the computer, making sure that they match up, and they do. So this is great. I'm going to go ahead and do hand hygiene. My name is Maddie. I'm a student nurse from LSC. I'm going to be collecting a clear void midstream from you today. And yeah, so let's get started. I'm going to put my gloves on. And my patient's independent, so she can collect the specimen herself, so I'm going to instruct her to do hand hygiene. And then I'm also going to go ahead and help her over to the bathroom. I'm instructing her to do pericare, so she is going to go ahead. You're going to keep your labia spread, and you're going to do both sides of the meatus. You're going to do front to back over the meatus to your bottom, and then you're going to keep your labia open while you're doing the collection. So you don't want any toilet paper or any bowel going into the specimen, and you also don't want any part of the peri area or hair to touch inside the specimen container, okay?
Okay.
You are going to go ahead and void 30 milliliters into the toilet, and then you're going to stop. You're going to void 10 milliliters, 10 to 15 milliliters in here, and then you're going to stop, and then you're going to finish your void into the toilet. So I'm going to go ahead and take off the cap of this without contaminating it. She is going to go ahead and void into the jar, which she did. Okay, this is great. And then without contaminating the lid or the inside of the specimen collection, I'm going to put this back on. She didn't touch the inside of this. And so now I'm going to go ahead and help my patient back to her bed. I'm going to remove my gloves properly, skin to skin here, disposing. I'm doing hand hygiene. My patient is in the lowest position with her side rails up. She has her call light. I have the right label on here according to the policy and procedure, specimen collection. And so now I'm going to document this, put in a biohazard bag, and send this to the lab. Skill complete.